What if I told you that some of the most common medical tests recommended after age 70 might actually increase your risk of harm, not health? You see, as we age, the body changes, hormones shift, metabolism slows, and our risk profile becomes completely different from when we were 30 or 40. Yet, and here's the problem, the healthcare system often treats a 75-year-old like a younger adult when it comes to screening tests, and that can backfire because a test is only as good as what you do with the results. And many of these tests lead to unnecessary medications, stress, surgeries, or worse, complications that never needed to happen. Now, don't get me wrong, medical testing can save lives, but only if it's used wisely and in the right context. Over-testing, especially in older adults, can create false alarms, overdiagnosis, and even physical damage. And that's what this video is about. How to think smarter about your health after 70 by avoiding checkups that may do more harm than good. Let me give you a quick example. A routine colonoscopy in a 75-year-old might sound like a smart precaution, but what most people don't realize is that the risks, like bowel perforation, anesthesia reactions, and even hospital-acquired infections, can outweigh the benefits once you pass a certain age. And if your overall metabolic health is solid, your risk of colon cancer may already be low. So the real question isn't which tests are you getting, but rather, do these tests make sense for your body at this stage of life? That's root cause thinking, the heart of functional medicine. In today's video, I'll break down 5 common medical checkups that are often pushed after 70 and why you should pause and reconsider them. We'll explore what's really going on inside your aging physiology, what the latest research says about these tests, and most importantly, what to do instead to protect your energy, clarity, and longevity. If you're in your 70s or beyond, or you're caring for someone who is, this information could dramatically shift how you approach your health journey. Here's what we're going to cover. Why certain scans may actually accelerate tissue damage in older adults. How over-testing creates a domino effect of unnecessary medications. The one lab panel that often misleads doctors into overprescribing. What research shows about PSA screening and prostate health risks. Why focusing on metabolic markers often matters more than isolated test results. And practical tools to evaluate your health without falling into the overdiagnosis trap. So stay with me, because avoiding the wrong tests might be just as important as doing the right one. Let's start with one of the most routine and most misunderstood checkups, the colonoscopy. Now, colon cancer is a serious concern, no question. But here's what most people over 70 don't realize. The risks of colonoscopy can actually outweigh the benefits as you get older. Let me explain this with a simple analogy. Imagine your digestive tract is like a long, winding hallway. A colonoscopy is like sending in a high-tech team with flashlights and tools to inspect every corner. But the problem is, by the time you're over 70, that hallway is more delicate. The walls are thinner. The risk of causing damage during that inspection increases dramatically. According to data from the U.S. Preventive Services Task Force, routine colonoscopy is generally not recommended past age 75 unless there's a strong personal or family history. Why? Because the procedure itself, especially under sedation, carries risks like bowel perforation, a tear in the intestine, which can be life-threatening, bleeding, especially if polyps are removed, adverse reactions to anesthesia, which increase with age, and most importantly, overdiagnosis of slow-growing polyps that would never have caused problems in your lifetime. So what's really going on inside the body here? As we age, the gut lining becomes more fragile. The microbiome, the trillions of bacteria that protect your immune system and regulate inflammation, also shifts. If you disturb that delicate ecosystem with a physically invasive procedure, it can throw off everything from digestion to immune resilience. Let me also point out something most doctors don't emphasize. Colon cancer is far more connected to chronic inflammation, insulin resistance, and gut microbiome dysfunction than it is to isolated genetic fate. In other words, you can reduce your colon cancer risk dramatically by optimizing your metabolic health, not just by getting scoped every 5 years. So what's the smarter path forward? Use less invasive screening tools like the FIT test, fecal immunochemical test, or Cologuard. These are stool-based screenings that are non-invasive, safe, and effective, especially when done annually. Support your gut microbiome with prebiotic-rich foods like leeks, garlic, asparagus, and fermented vegetables. These naturally lower inflammation in the colon, lower your insulin levels. Colon cancer risk rises with insulin resistance. Intermittent fasting, a low-carb, nutrient-dense diet, and walking after meals all help here. Track inflammatory markers like CRP, C-reactive protein, which can give you a clearer picture of systemic inflammation, a true root cause of cancer risk. And finally, know this: if you're metabolically healthy, active, and symptom-free, there is no strong evidence to support invasive colonoscopy past 75 in the general population. In fact, pushing for routine scopes in this age group can lead to fear, false alarms, and unnecessary harm. So the key takeaway here is this: screen smart, not hard. Protect your gut by improving the ecosystem inside, not just by overscanning it from the outside. If you're finding this helpful, take a second to like the video or subscribe. We dive into topics like this every day to help you make empowered, evidence-based health decisions. Next on our list is the annual PSA test, the prostate-specific antigen blood test that's commonly ordered for men over 50, and for many men over 70, it's done like clockwork year after year. But here's the truth: routine PSA screening in men over 70 often leads to unnecessary treatments, anxiety, and even long-term complications without significantly improving survival. Let's unpack what's really going on. The PSA test measures a protein produced by the prostate gland. Elevated PSA levels can signal prostate cancer, but they can also rise due to benign prostate enlargement, inflammation, urinary tract infections, or even riding a bicycle. Yes, really. Now, here's the key point. Prostate cancer in older men is typically slow growing. Many men die with it, not from it. So when we detect a small, low-grade prostate tumor in a man in his 70s, we're often identifying something that would have never caused harm in his lifetime. But once that test flags high PSA, a whole chain reaction begins. Biopsies, MRIs, stress and sleepless nights, potential radiation or surgery, and the worst part, side effects like incontinence and erectile dysfunction. So what does the research say? The U.S. Preventive Services Task Force does not recommend routine PSA screening in men over 70. A 2018 study in JAMA Internal Medicine found that over 50% of PSA-detected cancers in this age group were overdiagnosed, meaning they never would have progressed to cause harm. Let me give you an analogy. Imagine finding a small, slow-moving turtle in your backyard. It's not a threat, but if you call pest control, they might tear up the whole yard to remove it, causing far more damage than the turtle ever would have. That's overdiagnosis. So what's the better path forward? Don't rely on PSA alone. If your doctor recommends testing, discuss your age, symptoms, family history, and lifestyle risk factors. Ask, would this change my treatment plan or just my anxiety? Support prostate health through anti-inflammatory lifestyle choices. Research shows that insulin resistance and chronic inflammation drive abnormal cell growth, even in the prostate. Include cruciferous vegetables like broccoli and cauliflower. Add zinc-rich foods like pumpkin seeds. Reduce dairy and processed meat intake. Walk daily to support hormone balance. Track metabolic markers instead. Insulin, fasting glucose, and hsCRP can tell you far more about your cancer risk than PSA alone. Ask your doctor about active surveillance. If a minor issue is found, not every finding requires aggressive treatment. In many cases, watchful waiting is the safest choice, especially past age 70. Remember, the goal isn't just to find disease, it's to prevent the conditions that cause disease to grow. That's the functional medicine approach. So, unless you're showing specific urinary symptoms or have a strong family history, annual PSA testing after 70 might do more harm than good. And the stress of a false positive can quietly erode your health more than the condition itself. We'll look at why full body scans, especially CT scans, are being marketed to older adults, but may actually expose them to dangerous radiation without improving outcomes. Now, let's talk about a trend that's growing fast, especially among people over 60. It's the idea of getting a full body scan, usually a CT scan, just to see if anything's wrong. Often marketed as preventive or early detection, these scans promise peace of mind, but here's what most people don't realize. These scans can actually create more harm than help, especially after 70. Let me explain why. A CT scan is not just a fancy picture. It uses ionizing radiation, a form of energy that can damage DNA and, ironically, increase cancer risk with repeated exposure. According to data from the National Cancer Institute, CT scans may contribute to as many as 2% of all cancers in the US. That number is even more concerning when you consider how often these scans are done without clear medical justification. But what's really going on here? Let's say you're healthy, no symptoms, you go in for a full body scan just in case. The scan finds a tiny nodule in your lung or a shadow on your liver. It's probably nothing, maybe a harmless cyst or scar tissue from an old infection. But now the anxiety kicks in. Your doctor recommends follow-up scans, maybe even a biopsy, maybe exploratory surgery, and suddenly you're being treated for something that was never going to harm you, all because of a test that was never needed in the first place. That's what we call a false positive spiral, and it's common. Let me use an analogy. Imagine your house has some cosmetic cracks in the walls. A structural engineer walks in and insists on tearing down the entire living room just to make sure. That's what a full body scan can do, lead to structural overreaction when no real danger exists. Now, in emergency medicine, or when symptoms are present, CT scans are life-saving. But as a checkup tool in asymptomatic older adults, the data simply doesn't support it. Here's what you can do instead. Focus on targeted screenings when symptoms arise. Imaging should be symptom-driven, not driven by fear or marketing. Get a low radiation alternative when possible. For instance, MRI or ultrasound, when clinically indicated, can often provide useful information without the same radiation exposure. Reduce your need for scans by optimizing metabolic health. Remember, cancer growth, tissue damage, and chronic inflammation are rooted in high insulin levels, poor mitochondrial function, oxidative stress. Simple changes like time-restricted eating, antioxidant-rich foods, and walking daily reduce the likelihood that harmful processes are happening in the first place. Ask this critical question before any scan. Will this test change the course of my treatment or just increase uncertainty? And here's one more thing to consider. After 70, the cumulative burden of radiation matters. You've likely had multiple x-rays, dental imaging, maybe mammograms or previous scans. Every bit adds up. So before agreeing to a full-body CT just to be safe, think about what's really safe. If you're enjoying this breakdown and want more videos that go beyond surface-level advice, consider subscribing. I post daily content rooted in metabolic science, functional medicine, and practical tools for long-term health. Why bone density scans may not be as helpful as you think, and what really keeps your bones strong as you age. Now let's look at one of the most common tests recommended to older adults, especially women, the DEXA scan or bone density test. This scan is often positioned as essential for detecting osteoporosis, and it's widely used to justify medications meant to strengthen your bones. But here's what most people aren't told. DEXA scans often mislead, and medications based on these scans can cause more harm than good, especially after age 70. Let's break it down. The DEXA scan measures something called bone mineral density, a number that compares your bones to those of a healthy 30-year-old. Now pause for a moment. You're 75. Of course your bones are different than a 30-year-old's. That doesn't mean you're diseased. In fact, one of the most common findings on these scans is osteopenia, a fancy term for lower than average bone density, which isn't even a disease. But here's where it gets dangerous. That label alone often leads to prescriptions for drugs like bisphosphonates, Bonava, or Prolia injections. And these medications, they don't build new bone. They freeze the bone remodeling process, essentially locking old, brittle bone in place. Over time, that can lead to microfractures, jaw necrosis, esophageal irritation, and spontaneous fractures, particularly in the thigh bones. Let me use an analogy. Imagine you're trying to fix a cracked wall. One solution is to patch it with cement, but another, more natural solution is to reinforce the whole structure by rebuilding the frame. Bone medications patch things up, but they don't rebuild strength from the inside out. So what's really going on physiologically? Bone loss isn't just about calcium. It's about hormones, inflammation, muscle mass, and metabolic health. After 70, your ability to remodel bone is directly tied to insulin sensitivity, vitamin D levels, thyroid function, muscle strength, and weight-bearing activity. So instead of obsessing over a DEXA score, here's what to focus on. Build muscle. Muscle contraction stimulates bone growth. Resistance training 3x/week, even with light bands or body weight, is powerful bone medicine. Walk daily on uneven surfaces. This improves balance and loads the bones in different directions, keeping them active and adaptive. Focus on nutrients that regulate bone remodeling. Vitamin D3 plus K2 to help calcium go to the bones, not arteries. Magnesium, essential for calcium metabolism. Collagen-rich foods like bone broth or grass-fed gelatin support hormones naturally. Declines in estrogen and testosterone accelerate bone loss. Healthy fats, strength training, and sleep help maintain balance without resorting to risky synthetic hormone replacement. And if you've already had a DEXA scan, don't panic if you see osteopenia. That label alone does not mean you're destined to fall or fracture. Ask your doctor about your actual fracture risk, not just the bone density score. Remember, a strong bone is not just dense, it's flexible and metabolically active. Medications may artificially improve the scan result, but not your true bone health. Why routine blood tests in seniors often lead to a dangerous cascade of medications, and what to focus on instead for real health insight. Now let's talk about something that seems harmless, even helpful, but can quietly lead to serious harm in people over 70. Routine blood tests that trigger a cascade of unnecessary medications. You go in for a standard panel. Your cholesterol is flagged. Your blood pressure is a bit high in the clinic. Maybe your blood sugar nudges over 100, and suddenly you're on 3 new prescriptions: a statin, a blood pressure pill, and maybe even metformin. No symptoms, no real health crisis, but now you're caught in the trap of polypharmacy. And that's a real problem. Studies show that nearly 40% of people over 65 take 5 or more medications daily. And after 70, this number climbs even higher. But the more medications you're on, the higher your risk for drug interactions, cognitive decline, falls and fractures, liver and kidney stress, and something called prescribing cascade, where side effects from one drug lead to more drugs. So what's really happening here? Many conventional lab panels focus on individual biomarkers without considering the full metabolic picture. For example, a slightly elevated LDL cholesterol might lead to a statin, even though your HDL, triglycerides, and inflammation markers are fine. Mild fasting glucose of 1 in 5 could lead to diabetes meds, even though insulin resistance is the actual root cause. A borderline TSH level might lead to thyroid meds, even without symptoms or confirmed hypothyroidism. This is symptom-phymically, not root cause medicine. Let me use a quick analogy. Imagine your car's dashboard lights up with a few yellow warnings. Instead of checking the engine, your mechanic replaces half the car. That's what overreacting to isolated lab markers can do. So how do we fix this? Focus on functional markers, not just normal lab ranges. Instead of just looking at total cholesterol or fasting glucose, ask for fasting insulin to detect early insulin resistance, HOMO-IR to assess metabolic dysfunction, HSCRP to detect low-grade systemic inflammation, homocysteine for cardiovascular and cognitive health risk, ferritin too much iron in older adults can promote oxidative stress. Address lifestyle before medication. Most elevated labs in seniors can be improved or reversed through time-restricted eating, e.g. 14-10 or 16-8. A low-carb, nutrient-dense diet with leafy greens, healthy fats, and clean proteins, daily walking, resistance training, and sunlight exposure, stress reduction, since cortisol raises both blood sugar and blood pressure. Use supplements wisely, not reflexively. For example, instead of statins, support heart health with omega-3s, magnesium, and CoQ10. For mild glucose elevation, consider berberine, chromium, or alpha-lipoic acid. Always test before supplementing, especially with B12, vitamin D, or iron. Work with a practitioner who understands context. Ask, are these lab values a true sign of disease or part of a normal aging pattern? And above all, don't accept medications without a lifestyle intervention plan first. That's where real healing happens. If this resonates with you, be sure to like this video and subscribe if you haven't already. I post daily videos on how to restore health through functional, natural methods without getting trapped in the medication maze. Now we'll tie it all together with a smarter approach, how to assess your health with functional medicine tools that avoid the risks of over-testing. So far, we've uncovered how certain routine tests, colonoscopies, PSA checks, full-body scans, DEXA scans, and even standard blood panels can sometimes do more harm than good in adults over 70. The question now is, how do we monitor health without getting trapped in over-testing and over-treatment? That's where the functional medicine approach comes in, and it's not just about alternative health. It's about context, strategy, and personalized decision-making. Let me explain this with a simple framework. Instead of asking, what disease am I developing, we shift the question to what systems in my body are under stress and what can I do to restore balance? Because here's the truth. Most age conditions, from cancer to fractures to cognitive decline, are rooted in a few common patterns. Mitochondrial dysfunction, energy collapse at the cellular level, chronic inflammation, hormone dysregulation, loss of metabolic flexibility, your body's ability to switch between fuel sources, muscle loss, and nutrient depletion. These don't show up on traditional lab tests, at least not until the damage is done. So here's a smarter set of tools and assessments to consider using instead of routine high-risk screenings. Track metabolic health markers. These give a true read on your internal environment and disease risk, often before symptoms appear. Fasting insulin, ideal under 8 UU/ml. HOMA-IR, ideal under 1.5. Triglyceride 2 to HDL ratio, ideal under 2:1. Homocysteine, ideal under 1. Homocysteine, ideal under 10. UMOL/L, vitamin D3 levels, ideal 50 to 70 mg/ml. Use functional assessments of resilience. Rather than searching for disease, evaluate your body's adaptability. Grip strength and gait speed, both are powerful predictors of longevity, post-meal blood sugar response. Use a glucometer to see how you respond to real food. Heart rate variability, HRV, a great marker of stress, recovery, and nervous system health. Sleep tracking, quantity and quality impact everything from memory to hormone repair. Prioritize self-awareness over scan anxiety. The most powerful indicators of early dysfunction are often subtle shifts in how you feel. Waking up unrefreshed, feeling unusually cold or losing muscle tone, declining memory or motivation, digestive discomfort, bloating, or new food sensitivities. These are signals, not symptoms to suppress. Your body is speaking. The key is learning how to listen before relying on machines to shout it at you. Rebuild core systems instead of chasing numbers every week. Focus on simple root cause habits that restore your biology. Walk after every meal to lower postprandial glucose and support mitochondria. Strength train twice per week, even with resistance bands, to reverse muscle loss. First meal to activate mTOR and maintain bone and muscle. Get outside in the morning for natural circadian support and vitamin D synthesis. Fast at least 12 to 14 hours overnight to promote autophagy and metabolic repair. Here's the bottom line. You don't need to scan for problems you can prevent. By tracking the right markers, building the right habits, and focusing on functional systems instead of isolated diseases, you create a body that resists degeneration, even well into your 70s, 80s, and beyond. And that's the ultimate checkup. A life full of strength, clarity, and independence without overdiagnosis or medication dependency. Now, I'll summarize the key takeaways and give you a simple challenge you can act on today. Let's take a step back and review what we've really uncovered today. After 70, your body is changing, not breaking down, but evolving. And the key to staying healthy isn't running from disease, it's building resilience. That's where the power lies. We looked at 5 common checkups that are often pushed on older adults, but which can do more harm than good. routine colonoscopies that pose high risk and low benefit when the gut is stable, PSA testing that often leads to overtreatment of slow-growing prostate issues, full-body CT scans that expose you to radiation and create fear without clear benefit, bone density tests that label natural aging as disease and lead to brittle bone drugs, and standard blood panels that trigger cascades of prescriptions without solving root causes. But here's what's even more important. None of these tests fix the core issue because test results don't heal you, your choices do. When you think functionally, when you focus on inflammation, insulin, muscle, mitochondria, sleep, and nourishment, you begin to shift your internal terrain. You reduce the very risks these tests are looking for, naturally, proactively, without fear. And that's what health should be after 70. Calm, empowered, grounded. Here's what I want to leave you with. Don't chase numbers. Chase function. Don't fear disease. Focus on daily recovery. Don't rely on procedures. Build physiological resilience. And most of all, don't let a scan define your future. Your body is not a collection of risks. It's a self-healing system. And it still responds to every walk you take, every night you sleep deeply, every ounce of real food you give it. So here's my challenge to you. Pick one practice from today's video, just one. Maybe it's skipping that unnecessary scan. Maybe it's adding a 10-minute walk after dinner. Maybe it's asking your doctor about fasting insulin or CRP instead of just cholesterol. Start small, but stay consistent because that's where longevity comes from, not in the clinic, but in your kitchen, your mindset, and your movement. If this video helped reframe how you think about aging and checkups, I'd love for you to like it and consider subscribing. I post daily content like this to help you navigate the next chapter of life with energy, strength, and confidence. Let's build a future of less fear, fewer prescriptions, and more vitality together.